Hello, my name is Hunter Fridley, and I'll be your student nurse today. I'm just going to close the door to provide privacy and perform some hand hygiene, and I will be doing your cardiac, um, respiratory, and abdomen exam today. So before we get started, I just have some questions to ask you. Do you have any history of problems with your heart?
No,
Do you have any history of problems with your lungs?
no,
And then do you have any history of problems with your stomach?
no,
Okay, have you had any surgery in your stomach?
no,
Have you had any surgery with your lungs or any breathing?
no,
And then have you had any surgery with the cardiac region?
no,
Okay. Do you have any family history of cardiac problems?
no,
Do you have any family history of respiratory problems?
no,
And then do you have any family history of stomach problems?
no,
Okay. Do you smoke?
no,
Do you consume alcohol?
no,
Do you use any illicit drugs such as marijuana?
no,
And then do you vape?
no,
Okay. Have you noticed any problems with breathing?
no,
Have you had any shortness of breath?
no,
Have you noticed a cough?
no,
Have you noticed any abnormal swelling?
no,
Have you had any nausea or vomiting?
no,
Have you had any chest pain?
no,
Okay. And have you had any stomach pain?
no.
Okay. So can you state your age, please?
I'm 18.
What gender do you identify with?
I'm a male.
And can you say your name real quick?
Wade Fridley.
Do you know why we're here today?
A health assessment.
And do you know what year it is?
2020.
And do you know where we are right now?
We're at my apartment.
Okay, so I am here with Wade Fridley. He appears to be a stated age of 18 years old. He is a white male, and his body appears to be symmetrical. He is dressed appropriately for the current weather. His hygiene is good, and he does not seem disheveled. Uh, he his facial expression is neutral, and he does not show any signs of droop or on either side of his face. His speech is clear, and he does not show any lisp or slurring. Um, and he is alert and oriented times 4. Okay, so now we are going to. Oh, and he does not have any physical deformities that I can see. Okay, so now we're going to start with the health exam. So can I have you take your shirt off and put your feet on the bed facing the wall? Okay, so I'm going to begin by inspecting Wade's back or his posterior thorax, looking for any lesions, edema, or masses. Wade appears to have a symmetrical back. He does not appear to have any scoliosis in his back. His spine is straight. He does not have any erythema lesions or edema on his back. And now I'm going to begin by and his chest, his back expands equally as he breathes. So now I'm going to palpate or touch for temperature and expansion. So Wade, I'm going to be touching your back with my back of my hands. Wade's back has a uniform temperature. It is warm to the touch, and did you feel any tenderness as I was touching your back?
No,
He did not feel any tenderness as I was touching his back. He does not have any abnormal coldness or heat. His skin appears to be full colored and in good condition throughout his entire back. So now I'm going to start by auscultating your lungs. So what I'm going to do is I'm going to be putting my stethoscope on your back and listening to your lungs. And every time that I move my stethoscope, please take a deep breath in and out of your mouth. And can you cross your arms in front of your chest? Okay, you can face me again. And Wade does not appear to have any signs of wheezing or stridor in his lungs. He doesn't have any crackling, and his breaths appear to be full. So now I'm going to be moving on to his neck. I'm just going to palpate his carotid artery. So I'm just going to be touching your neck and feeling your pulse. Okay, Wade's carotid artery is 2+. It is normal strength, and he has a regular rhythm. He does not have any decreased beats while he breathes. Okay, so now I'm going to be moving on to your chest or his anterior thorax. I'm going to be first looking at inspecting Wade's chest, looking for any lesions, erythema, edema, or masses. Um, it appears as though Wade's skin is full throughout, or his skin color is full throughout his chest. He does not have any pallor or abnormal color or discolorations throughout his chest. He does not have any lesions on his chest, and his chest expansion appears to be equal on each side as he breathes. So now I'm going to be palpating for tenderness and temperature. Once again, same thing with the back of my hands. I'm going to be touching your chest, going up and down. Wade has a uniform temperature throughout his chest. It does not appear to be too cold or too warm. It is uniformly the same temperature throughout his entire chest. And now I'm going to be auscultating his lungs, listening for any abnormal sounds throughout his lungs. So I'm going to have you do the same thing, Wade, while I listen to your lungs. Just take a deep breath in through your mouth each time that I move my stethoscope. Okay, Wade's lungs appear to be have normal breath sounds. He does not appear to have any stridor, crackling, or wheezing in his lungs. So now I'm going to be moving on to his heart. So to begin, I'm going to be listening to his mitral valves and I'm going to begin by listening to his aortic valve on the right side of his chest in the second intercostal space. So I'm going to start with my diaphragm to listen for high-pitched sounds. So I'm starting in the second intercostal space on the right side of his chest. Now I'm moving over to the second intercostal space on the left side of his chest to listen to his pulmonic valve. Now I'm moving down to the fourth intercostal space to listen to his tricuspid valve. And now I'm going to listen to his mitral valve for a full minute in the fifth intercostal space. Through listening with the diaphragm, he appears to have normal lung sound or normal heart sounds and a regular beat. I'm going to now start by listening to his heart once again, but with the bell of my stethoscope. So I'm going to be flipping it. I'm going to be listening through to the same valves, but checking for wheezing and any additional sounds like S3 or S4. Starting with his aortic valve on the right side of his chest in the second intercostal space. Moving over to his pulmonic in the second intercostal space on the left side. Moving down to his tricuspid and the fourth intercostal space, and down to the mitral valve in the fifth intercostal space at the mid-clavicular line. Wade does not appear to have any wheezing or additional sounds throughout his chest, throughout his heart. Now I'm going to be moving on to the abdomen. So I'm going to have you lay down on the bed, Wade. And I'm going to be starting off by inspecting Wade's abdomen. He appears to have a flat contour of his abdomen. He does not appear to have a protruding stomach. He does not have any lesions, erythema, edema, or masses on his stomach. His abdomen is symmetrical with the umbilicus in the middle of his stomach. So now I'm going to be moving on to auscultating. I'm going to listen to each quadrant of his stomach with the diaphragm. I'm going to start in the right lower quadrant and move through the 4 quadrants clockwise. Wade appears to have normal active abdomen sounds. I could hear in each region. He does not appear to have hypo or hyperactive vowel sounds. So now I'm going to be moving on to percussion. I'm going to be percussing each region of his stomach, of his abdomen, and listening for tympanic or Dolan sounds. So I'm going to begin. Wade appears to have tympanic sounds, so his stomach. I did not hear any dullness besides up in his upper right quadrant where the liver is. I could hear a little dullness in that region. Now I'm going to move into palpation. I'm going to start with some soft palpation. So Wade, I'm going to be touching your stomach and feeling for any masses, and let me know if there's any tenderness as I do this. So now I'm going to be doing deep palpation, pushing a little bit harder, looking for any enlarged organs. Did you feel any tenderness as I did that?
No.
Okay, so Wade does not appear to have any additional masses or enlarged masses in his stomach or organs. You can sit up now. He did not feel any pain as I was going through his stomach, his abdomen, and he did not appear to have any issues. So thank you for your time. I'm just going to perform hand hygiene one more time, and that is all I have for you today. So thank you.